In this episode, we will learn about insulin and its management.
The first way of administering insulin is using a syringe. This is how a syringe looks. The second way of administering insulin is using insulin pens. The first type is basically a disposable type of pen. Here you will not be able to refill it. The second type is a reusable pen. Here you will be able to open it and put the new cartridge. The third way of administering insulin is by using an insulin pump. This is how an insulin cartridge looks, and these are your disposable needles. The best and the easiest way of administering insulin is using an insulin pen. The insulin pen comprises of three main components. One, the pen itself. Second, insulin cartridges. Third, insulin needles. Please note, for every cartridge you get a different insulin pen. So depending on the insulin prescribed by your doctor, you get respective pens. First, let's see how to fill the insulin pen. Open up the insulin pen. Unlock it. Place the insulin cartridge inside. You don't need to prick or make any hole. Lock it up again. Take the needle. You have a green color paper cover on this. Just peel that cover off. Place it onto your insulin pen and rotate till the time it gets locked. Once that happens, just take this cap off. This is how our insulin pen will look to you. This cap will always be on. Whenever you are administering the insulin, you will take this cap off, administer the insulin and place this cap back again, and the main cap again. The insulin pens always need to be stored in the refrigerator. Basically in the refrigerator door, so where you keep bottles or eggs, that's the place where you can keep your insulin pen too.
Let me show you how to administer the insulin using a pen. All the pens will have a window and they'll have numbers all the way till 60. Depending on how much ever insulin has been prescribed by your doctor, all you need to do is just rotate to that number. For instance, if your doctor has prescribed 10 units, you just roll in to 10. Remove the cap and using your thumb at the upper portion, you need to inject. The various sites where you can give the injection is as shown in the image. Let me show you how to take insulin on your arm. If someone else is giving you the injection shot, then the arm is the most easiest place to give it. If you are taking it yourself, that can be a slight trouble. After you finish rotating the units of insulin onto your pen, take the cap out. With one hand, create a minor pinch. You don't need to do this. It's just a minor pinch that you need to create. Keeping it at a perpendicular angle, inject the needle inside and press. Count till about 10 and then release. The reason I'm asking you to count till about 10 is if you take it out immediately, the insulin with the pressure can come to the upper surface back again. A very important point that you guys need to keep in mind with your diabetes management is your sugars going low. Throughout the day, at any point, if you feel giddy or if you feel your hands tremoring or you're randomly sweating, not because of the heat, but in spite of sitting under the fan, you're sweating, those are your signs of your sugars going low. At that point of time, if you guys are at home, immediately just take sugar, plain sugar, directly, or you can just mix it in water and have that. If you're outside somewhere, the simple candies that we get in the market like Mango Bite or Alpenliebe, you can take about 2 to 3 of them. If not that, the Tetra packs of Fruity or Tropicana, those are also a good option for raising your sugars immediately. Just note that these are only when your sugars are going low and not otherwise. If at all you have a glucometer around with you at that time, just check how much your sugar is at that point of time and then take the required dosage of sugar. I hope this video was informative. If you have liked this video, do hit the like button, share it, and if you have any suggestions, do comment down below. Thank you.